Good afternoon, everybody. This is David Friedman with my co-host Dave Burkus on TCA Crossroads, where investors and entrepreneurs connect. How are you, Dave?
I'm doing fine. Here it is, still in wintertime, I guess. Getting a little closer to spring and feeling good. It's been a very good time for all of us, including in the investment environment. So I
Yeah,
understand that you have a guest to introduce today, and that we have a real talk today about medicine and AI.
yeah. I'm excited about it. I'm going to bring Shawn on. Shawn is, a really unique individual. Comes from an entrepreneurial background. Now set up his own shop, and we're going to have a really interesting discussion that's very relevant to precision medicine, AI, and everything else.
Okay.
And there he is. Welcome, Shawn.
Thank you, guys. It's my pleasure.
Well, good to see you. So let me give you a quick background on Shawn, and then he'll correct what I'm saying. Shawn is currently the founder of a company called LifeModeler. It's a professional services group. He's an entrepreneur expert in AI in what they call high consequence medical environments. I've known Shawn for about 7 years now, very sharp. I'm pimping the bit here, but extremely sharp. And I'm looking forward to an engaging and very practical conversation on how AI is applied, what the upside, the downside, and a variety of other questions that we'll get to. So why don't you say a few things about yourself and how you got here, and then we'll go on with the questions.
Of course. Thank you, gentlemen, for having me. So basically, I've been doing this for a long time. I'm about a 30-year pioneer in developing human simulation, which is this stuff here behind me. It's developing physics-based human models that can actually move and so forth. And when I first developed them, we were looking at product development. So looking at products that were used in the human or by the human, that type of thing. And so I will being the first really in this industry 30 years ago, we were fortunate enough to have access to a lot of different industries like medical, sports, automotive, anything that there was a human involved or something that was used in the human. And so where we really hung our hat was in the medical device, because what we ended up being is a virtual prototyping solution for medicine or joint replacements in particular. And so our physics-based models, we'd be able to, before anything was created, look at concepts implanted in our models and have them do everyday type of activities, and then figure out how you can optimize things, optimize geometry, materials, and those kinds of things. It worked quite well because it's very easy to justify the ROI because we're basically reducing the need for physical prototypes and really helping the design, accelerate the design. And so this sort of became a decision type of thing. We looked at it now, since we have a platform where we can develop product. How about if we develop a platform further where we can look at implanting the product or surgical type systems? And so this is quite a while ago, and we looked at using the software to embed in surgical orthopedic robots, such as the ones that work on folks for hip replacements or knee replacements, using the same type of technology. And then we started to involve AI in this loop as well. AI, we would bring in post-surgeries and how successful surgeries had happened and what exactly the surgeon did for a good outcome. And we combined this all together to create a plan that was implemented through the robot. So through all this, I had to deal with the FDA, obviously. We were being one of the first to deploy this. We were part of a working group where we were developing new 510K regulatory document sets and things like that. So a lot of new protocols, because it was the very first time the FDA looked at software as a surgical device. And so we were subject to the same type of constraints as, say, a new hip replacement was, and those kinds of things. So I got to see the whole thing. And then finally, we deployed it in the surgical robots. And so I understood intimately what controls were necessary in order to make sure, first of all, it would pass through regulatory, but also so that it wouldn't hurt the patient for any type of outlier or a pathological.
Let me step back for 1 second. We talk about these things called the high consequence environments. Can you explain to the listener what you mean by a high consequence environment? And then we can get into maybe some, an example of where this could be really problematic or it could be useful.
Yeah, especially you can just imagine in the medical space, the consequences are huge. In fact, I was just reading I think it was an article in Reuters a couple of days ago about a system that was used for cranial fascial operations, and it screwed up. And there were patients who were injured to the point where they were leaking brain fluid, and there were strokes, and there was a lot of problems there. So the consequences can be quite severe. The controls that we looked at building in, where the human was in the loop at every part of the workflow, whether it was data collection on when they brought in information from the patient, or it was the analysis itself. We had engineers reviewing the plan, and then deployment, where the surgeon can always override the robot if he didn't like what the robot was telling him.
When we talk about the AI environment, there's an issue of trust. I mean, I'm going back to your comment about the physician saying, I override it or not. Where does that trust start and stop? In other words, you have generative AI, you have agentic AI. Should I believe everything? The decisions are being made by AI. How does human in the loop interplay with that? And what's an example? Can you give us a further example, maybe from your?
Yeah, in order to build trust, you have to have consistent outcomes that the surgeon believes are the right thing. And so that's just a matter of using it. We find that surgeons in the beginning are very skittish, and they tend to override the robot quite often. But after a few good cases come through, then they become less skittish on that, and they let the robot take over. One of the challenges we had when working with the FDA is we explained to them all the controls during our risk analysis when following the documentation. And they said, well, the problem with that, being able to have the surgeon pull control away is a lot of surgeons might be over-reliant on the robot, because some surgeons are doing 2 cases at one time and that type of thing. So they can over-rely on the robot. So we had to make sure that it was very clear that the surgeon was required to go through some of the checks in surgery to make sure that the plan was correct.
That kind of very cautious approach is the FDA's common approach. And you are now attempting, or have attempted, the 510K route rather than de novo. It's a lot less expensive, I know. How has the FDA reacted to all of this?
Well, I think there's a problem now, because it seems like, I was been reading this Reuters article. There's been about 1,300 products that have AI either embedded in them or some aspect of them.
Wow. In
surgical products and pacemakers and so forth. And they cite one of the problems as being that the FDA is a little bit underfunded now. The FDA is overwhelmed with all the technology that's coming through. So there might be a little bit of flow that's going through that's kind of relatively unchecked. But some of these recalls will certainly tighten up the system and cause them to change the way they're doing things.
Very good. And I imagine the FDA is probably slower because it's underfunded.
Absolutely. Yes.
We're experiencing the same thing with the SBA having closed.
Yeah, that's right.
So we're hearing this a lot.
Yeah.
So I'm going to flip it around to the other side. We talk about the FDA now. You're a consultant to small startups in this environment. You've been in the business a while. Let's say I'm a startup. I want to develop something that is going to include, I want a 1301. I'm going to be the 1301st company. Now, what I want to do is do something with AI. What would you advise me to do or not do? And the reason why I'm asking is we see a lot of these businesses, everything almost that comes to TCA is
Yeah.
AI. If they don't have AI, they feel like they're losing
Oh, yeah.
something. So, but
Absolutely.
what do you tell people? And then I really want to probe what is really AI versus just algorithms.
Yeah, that's a great question. In fact, I've been very busy in my group now. Is we're not just working in the medical space, we're working in the financial space, the legal space, and a
Cool.
lot of areas where the problems are all very similar. And it starts kind of like this: is everybody wants to say they have AI in their board meetings and their press releases and that kind of thing. So they go out and they buy a lot of licenses. They put out a lot of capital to bring the stuff in. And then there's kind of a wall they hit where they play around with it a little bit and they run into some problems and they're not quite sure how to deploy it. We're working with a company, a legal group down in San Diego right now, that they know they have this investment and they have to figure out how to make it more of a tool for their analysts without overburdening them.
Yep.
And so this is very, very common. In fact, that's kind of why I'm back in the business doing this work, is some of the insights that we gained in running it through a highly regulated environment like the medical space. All those checks and balances and ownership questions and alignment issues, those transfer exactly across domains. And so it's very, very similar, and you can kind of boil it down to, everybody's played with ChatGPT. They know it's like this wild horse that has access to all the world's data. But one thing that they forget about, or they learn a little bit into it, is that in dealing with AI, it doesn't have the normal constraints that humans have. So when I'm talking to you, if I say something like, I'm going to go lift this Volkswagen up in the middle of our conversation, I would never do that because it doesn't make any sense. But when you're dealing with AI, it has to be specifically constrained that it wouldn't allow for that type of question. There's a great Super Bowl commercial. I don't know if you guys saw it, but it was that one on Anthropic where the guy was interviewing it was a bot for, it was like a family help bot. And the bot is trying to say, yeah, here we're going to help you improve your relationship with your grandmother. And we suggest having common interests and then developing conversation right with that. And then further on it goes. And if that doesn't work out, there's a cougar website where you can get another woman of that age. See, it's that whole paradigm where, and everything really boils down to that core, getting back to the last part of your question, David, everything boils down to, it's very similar. They can paint all these UIs and harnesses and everything around it, and it can be very specific to an industry, but the core is this wild beast that needs constraints.
So the other issue that you kind of touch on, Shawn, is the issue of ethics and morals. What are some of the concerns that entrepreneurs and investors need to look at before they either invest or they develop a product? Because we don't want AI to do something that's untoward. We
Right.
want to use it as a support, I think, at this time, versus decision making, other than like in an autonomous, factory or something. So where are the guardrails around AI, especially in these high consequence environments? I mean, we talked about healthcare a little. You mentioned legal and financial, and I can see a whole bunch of things in the financial world coming unglued if you make the wrong decision on AI. All of a sudden, it's now trading, unsecured puts, in somebody's accounts, and all of a sudden, there's tremendous liability. Where are the guardrails? Where's the morals and the ethics surrounding it?
Yeah, you're exactly right. And going back to my first example, is those have to be explicitly put into your AI solution. There's no magic shrink wrap solution that somebody can buy and then expect it to be deployed. Everything has to be customized to your ecosystem. And so everyone has these set of constraints that need to be just conceptualized and then built into the AI. So part of the integration is being able to come up with a constraint listing that you can then customize your GPT or your custom software in order to stay within those boundaries. But really, it's just involves a big brainstorming with your staff, thinking completely outside the box about what could go wrong, and then being able to create these constraints in an algorithm that you can use to train your AI. But it's very similar across all industries, really. And the better companies do those kinds of things, and then they also, when it's deployed in the workflow, they also have checks and balances and humans in the loop. They know who's accountable if something goes wrong. They have audit patterns when something goes wrong, so they can do a forensic on their system and go and fix it.
So, Shawn, turns out that there are large language models and they hallucinate a lot. And there are small language models where you can load your own data and kind of fence it in. When you have this kind of a conversation, are you allowing AI to just roam free and get any data that's going to find? Or do you
no. Oh, absolutely not. I mean, there's a certain amount of latitude you want to give it in with certain silos for your various industries. But eventually it's going to run into a wall. Like, for example, the company I'm working with down in San Diego right now is they produce financial reports for investors on the medical space. And so it involves bringing in lots and lots of Medicare data from various government sites and all these things. And a lot of that data is walled off, and also, or isn't in a way, in a flavor that is even useful. And there's some conflicting data, and out there it's kind of a mess because it wasn't designed. The data storage and capture mechanism of, say, the government was not designed to be exposed in a way that AI agents can take it up and make use out of it. So that's sort of a natural barrier where you're going to have a human in the loop that can go and sometimes log into a website, get past a paywall, build an Excel spreadsheet, and pipe it into your AI solution.
So here you keep mentioning, and you have several times, this human in a loop. I want to focus on two things. Number one, do you see any time in the near future where the human will not be in the loop, especially as we move towards agentic AI? And number two, where do you see the momentum going now? Where is it the strongest? Let's stay in the healthcare area for using AI to the benefit of mankind. So let's take a look at the first question on human in the loop. Do you see it coming? Do you see human in the loops becoming the norm over the next several years, or do you see it dissipating?
David, I can't see how the human could not be in the loop. Good. Just because there are so many unanticipated consequences out there, depending on the business. For example, in the medical space, there are so many outlier patients, right? If you look at some of the physicality of people that are getting a knee replacement, it's really all over the map. And if you combine that with their expectations in terms of how, if they want to go golfing or whatnot, there's so many cases that can just not be within the comfortable space of the AI. And so there will, in my opinion, there will always be a human in the loop to shepherd and control this for the time being, and probably for the near or even distant future. I don't see it just blasting off and solving all problems. And agentic AI is just another name for agents, and you can have interesting combinations of agents and loops and all that kind of stuff. And that's just technology. It's not the control that you need. So technology is moving fast, and it's amazing. I mean, how many new chatbots do we get? We're getting a new update every day, and but deployment now is stalled. I mean, it really is, as you guys know, right? And with your funding business, it's stalled. People can mention AI in the boardroom is all they want, but to be able to to derive a good ROI, there's not a lot that's happening right now.
Yeah, you're very right. It's happening in human resources and accounting and the areas that are very mechanical.
Yeah.
But the real question about the things you're talking about, whether or not a particular surgery goes bad.
Mhm.
However, 5 years from now, we'll look back and say, maybe not. Maybe that
Yeah.
could have been done.
Right. You're exactly right, Dave. As an entrepreneur in the techno space, I never ever think, when I hit a technology wall, I never get pessimistic. I always think one day we'll get over that. Plan as if.
Let me change to, as we get towards the end of our discussion, which I'm really enjoying. I wish it could go a lot
Thank
longer.
you.
But what advice do you give to engineers or CEOs of startups when they want to incorporate AI? And again, going back to, is this really AI or algorithms? And how do they present that, flipping it around the other way, to us who are the investors in it?
Yeah, it's a huge span between the CEOs and your engineers. But oddly enough, the solution is exactly the same for both. I'm sure you guys have played with chatbots and AI to a certain extent, and I would encourage CEOs and engineers to begin that way, and you can move all over the place just for your personal life, whether or not you're doing your personal finances, setting up business trips or whatnot. But the technology that we have available today is so workable that anybody has access to it now, can actually interact with it in a way that can really understand not only what the potential is, but what the current drawbacks are once they see garbage, from one of their queries. And so that's a really good start. And I think it's kind of unique for this type of technology, because there's not a lot of technology out there where you can go and play with it in a sandbox over here and get a little idea what's going on. You're not going to take some human modeling software and play with it and say, yeah, I'm comfortable with it because I can anticipate the outcome when I do stuff. But AI is exactly the opposite. You can play with it. You can understand it to the point where you can deploy it within your infrastructure and your workflows and have a good sense of what it should do and what it can't and why it can be dangerous.
And yet, because so many companies don't understand this,
Right.
and so many boards try and push their companies without realizing what they're saying, you're going to find yourself busy for, I think, a couple of years at least.
Yeah, it's crazy busy. You're right, Dave. Yes. But it's fun. It's a remarkable problem. Nowhere in my history have I ever seen a technology take over like this. I mean, not even the dot-coms and the internet really, but this technology, which is so advanced and accessible and present everywhere, everyone wants to get involved with it. It's just such a great potential for making things better.
That's kind of a good summary, David.
I think it is a good summary. I want to give you the final word, though, Shawn. What are the 3 things you want to tell either the investor or the entrepreneur to be aware of as they go through AI? And just, it's totally up to you. But this is the great takeaway from this podcast.
Yeah, number 1 is scale your expectations.
Perfect.
Don't be caught up with all the AI mentions in the board meeting notes or in their sales literature or any of that. Scale your expectations. Be more realistic of what it can do and how it can be deployed. I think that's number 1, and that's really the main thing that. And in doing so, I go back to my first example. You play around with AI, you kind of understand it, you can kind of get an idea how it can scale. So it makes you very intimate and close with this technology, so you can hopefully scale your expectations.
Well, I really appreciate you having the opportunity for you to come on board, talk about AI from a practical perspective. You've lived it for a long time. You've talked about the high consequence markets of law, finance, mostly healthcare. I totally believe it. The one good news that I have, Dave, is that I don't think we're going to be replaced by a digital twin quite yet.
We're close.
That would be interesting. It gives me my Friday afternoon back for using golf and using AI in my artificial hip to make that swing better, I guess.
Next week, Shawn will be here, and he'll be here again with his avatar.
Thank you, guys. I just got my artificial hip 3 weeks ago, by the way.
Oh,
Yeah, that's why I mentioned it. Yeah, I
There
knew
you go.
that. Yeah, I know.
Exactly.
But anyway, on behalf of Dave and myself, Shawn, thank you so much, and to the viewer audience, hope you got something out of this. AI is here to stay. It's a great complementary technology for what you're doing. Don't let AI run it. You always will need a human in the loop with some guardrails around it from an ethics and a legal and a moral perspective, but use it to your advantage. And when you do that, make sure it's very clear what AI is doing, how it's scaled, so you can make that really great pitch to the investors, so we can look forward to seeing you on the cover of Forbes magazine as the next billionaire. And with that, Dave, you want to finally close it out?
ladies and gentlemen, thank you very much for attending, and we'll certainly see you at the next crossroads.
Gentlemen.